Dental professionals are trusted to provide competent care for all patients. However, current dental training often focuses on the most typical patient, which can translate to gaps in care when treating patients with mouth morphologies that deviate from the norm. This results in fewer dentists that can accommodate special needs patients with atypical mouth morphologies. And these patients are often on waiting lists for months or even years before they can undergo a simple dental procedure such as a teeth cleaning. Dental students begin training for clinical settings early on in their education, typically using a mannequin with removable teeth called a typodont. This gold standard training device is used to practice for procedures such as fillings, cleanings, and restorative work. The mouths and teeth of these mannequins are meant to represent a very typical mouth, with no crowding, no crossbite, and no tongue in the way. Patients with Down syndrome have differences in all of these features. They tend to have larger tongues relative to their mouths, crossbites, and higher vaulted palates. Patients with cerebral palsy also have significantly different morphology, with narrower mouths, more crowding, and higher arched palates. We considered ways in which we could make a training device that would allow dental professionals to train on mouth morphologies that are not currently modeled by existing training devices. We had to find ways to include these differences while also retaining the necessary aspects of current trainers. We created our first prototype based on what we had seen in dental clinics and what we knew we needed to carry over from the current training devices. We 3D printed the throat portion, crafted a tongue and teeth, and put it all together with low-resolution materials. We decided to have our training device include 3 main features: an adjustable jaw, a tongue, and removable teeth. These were based on the features of the traditional trainer that we knew worked well and were important to carry over. We experimented with and will continue to experiment with different materials for 3D printing the jawbone, gums, and throat. Different filaments will be used to print the throat portion and match the real thing. We created a tongue of gelatin to mimic the mechanical properties and feel of a real tongue. We then completed a risk and hazards analysis so we can be more prepared for possible issues that arise from our training device, listing the potential problems and solutions. We will clear our initial designs with our mentors, Dr. Tyklet, Director of the Center for Patients with Special Needs, and Dr. Samosky, Director of Medical Simulation. Input from both a clinician and an expert in the field of medical trainers is beneficial in ensuring that all aspects of the unmet needs are met. Revisions will be made to ensure verification, and we will freeze the design next semester. Our validation efforts are aimed to ensure our training device satisfies the needs of the dental professionals. We plan on recruiting dental students and practicing dentists to test our device. Participants will then fill out a survey asking about their feelings of preparedness and how similar the mouth morphologies are to patients with Down syndrome and cerebral palsy. Once validated, we hope that it can be used to give dental professionals a more inclusive and accurate education to be able to provide the same standard of care to more groups of patients.